Well, hello to everyone who has joined us today. My name is Rachel Vreeman. I am a pediatrician and an HIV researcher, and I'm the chair of the Department of Global Health at the Icahn School of Medicine at Mount Sinai, where I also have the privilege of directing the Arnhold Institute for Global Health. The Arnhold Institute for Global Health has been hosting a series of webinar events on COVID-19 and various aspects of global health as well with it. We're incredibly excited to continue with that series today with our guest, Dr. Rhea Boyd. As a few words of framing, first, we will have the opportunity at the end of the hour for participants, people who are joining us today, to ask questions. If you have questions at any point, you're welcome to put them in the Q&A box that you see at the bottom of your screen. You can type them in there and we'll select some of those questions as we have time at the end of the hour. Without further ado, it's my great privilege to introduce Dr. Rhea Boyd to everyone today. Dr. Boyd is a pediatrician. She is a public health advocate and a scholar who writes and teaches on the relationship between structural racism, inequity, and health. She has a particular focus on child health and the public health impacts of harmful policing practices and policies. Dr. Boyd serves as the Chief Medical Officer of San Diego 211, where she works with navigators to address social needs of people living in San Diego who are impacted by chronic illness and poverty. And she's also the Director of Equity and Justice for the California Children's Trust, which is an initiative to advance mental health access to children and youth across California. Dr. Boyd graduated cum laude with a BA in Africana Studies and Health from the University of Notre Dame. She earned her MD at Vanderbilt University School of Medicine and completed her pediatrics residency at the University of California in San Francisco. In 2017, she also graduated from the Commonwealth Fund's Mongan Minority Health Policy Fellowship at Harvard University School of Public Health, where she also earned a Master's of Public Health. We're incredibly lucky and fortunate to have her with us for this hour of asking questions today. I'm really excited. I'm always a little biased when I have a fellow pediatrician to talk to, but I'm also a fan of yours from Twitter and from things you've been writing for several years that I've been aware of, and I really am delighted for this time with you today. So thank you and welcome to our session today.
Thanks so much for having me. I'm excited to chat and hear everyone's questions.
Great. Well, I thought to offer a little bit of framing. I actually wanted to pull from your own testimony in front of Congress recently, which congratulations for having that platform. I'm so glad that your voice was there. And from your testimony, some of the key facts that you brought up to Congress were that COVID-19 deaths happen at a 6 times higher rate for those who are living in predominantly non-white communities right now in our country. And when we look among people who are ages 35 to 45, so pretty young adults in the scheme of things, we see that Black people right now have a COVID mortality rate that's 9 times higher than white people in the US. We also know at the same time the terrible number that 1 in 1,000 Black men will be murdered by the police. And so I bring these statistics up so that we can start off our conversation about how structural racism leads to these disproportionate deaths among Black people and this incredible burden on Black communities from these serious public health threats, both from COVID-19 and from police violence. And since we get to spend this hour with one of America's leading scholars on structural racism and inequity in health, I think it's a really critical time for us to consider what more we can learn from you today. So maybe as a starting place, could you share with us a bit about the kind of work that you do as a pediatrician, as an academic, as a child and public health advocate, and perhaps a little bit too about how that work that you've been engaged with has perhaps shifted over recent months, especially?
Yeah, thank you for that question. I'll first say, those are some really startling and alarming statistics that you shared. And I think it's important that we all just take a moment and let those numbers kind of sit with us. Mm-hmm. What Black people are facing in this country is horrific. And it's been horrific for centuries, but we know even more about it right now. And as we hear these numbers and we talk about what is essentially an enormous risk for premature death among Black folks in this country, regardless of your age, like, we have to treat that with a certain level of gravity and, you know, moroseness that it needs. Like, what we are going to talk about today is deeply sad. And many of us, including, I'm sure, you know, our other panelists and the people who are listening and watching, are mourning communities, family members, people who have been lost by the many ways racism shortens our lives.
Yeah.
So I just want to say that before we start, because it's a dark conversation. And I frankly have been having it in a number of circles, and it's hard to have over and over and over again. It's hard to hear those numbers because they're not just numbers, right? These are human beings, their moms, their dads, their kids, their aunts and uncles, their neighbors. These are people that we loved and that we still love. So with that, I'll say, what do I do? So I'm a pediatrician. I work clinically part-time, and I spend the rest of my time in community-based partnerships. Over the last decade or so, those partnerships have focused on the impacts of police violence on the lives of children and on broader public health for counties and states. And I do a fair bit of teaching and writing around those topics, around police violence and the ways that racism harms people's health, particularly the health of Black folks, but it harms everyone's health, including white folks, although not in the same way. And we can talk about that if folks are interested. And I try to strike this balance between serving individual patients and individual families, and also thinking of the larger systematic drivers that make whatever I do in clinic less effective. And so I also want to think about the ways inequality causes health problems and think about ways that I can address that as a physician advocate.
Thank you. And I really appreciate the framing in terms of the importance of considering the very personal and human burden that goes along with us. I know when I talk about HIV work as well, I often try to counteract these terrible numbers with stories where I can, as stories meant to help bring some of that that person focus into it. And I really appreciate you starting with that. I think your voice in that and the heart that it brings to this discussion is really critical, even as we think about these numbers and as the numbers are, important to think about, and the research behind them as well in that way. Terrific. I guess, so one of the things I did really want to ask you about, because I think you have really highlighted this in a way that's been quite important as we've started increasingly as a society to see the burdens of to really talk about, perhaps people have certainly been seeing it, but to talk more and more about the burden of police brutality. You've highlighted some of the key impacts for police brutality on children and adolescents, and the ways that it impacts them through various mechanisms. And I was hoping you could talk a bit more about that with us, in part because I think we sometimes do forget about kids in these discussions, but especially trying to understand more fully how exposure to things like racial profiling, police violence directly, and then also witnessing encounters with the police, both in their communities and in their families, might impact children's health.
Definitely. So first, I want us to broaden what we are thinking of when we think about police brutality. So often the image that comes to mind is one of violence against one victim. But we also have to think about what we've been terming adverse policing exposures, which are any exposures that children, or really any person of any age, has with police that has a negative outcome on the other side, that is often a life-changing outcome. So what are some of those examples? When we think about the effects of police brutality or adverse policing exposures on kids, we think specifically about how exposures to police disappear caregivers. What are some of those exposures? So some of them may be, you know, the experience that the Floyd family is now having without their father, right? George Floyd was a father who had a daughter who now is living without him.
Mhm.
We also have to think about folks who are incarcerated or arrested as a result of their police encounter. That also takes a primary caregiver out of a child's life. We also have to think about the ways borders are also a form of brutality to separate human beings who would otherwise, right, interact, be neighbors, work alongside each other. And then we use those borders to reinforce policies that also disappear caregivers from the lives of certain immigrant families, like ICE regulations
Yeah.
and ICE raids. So when we think about how policing is used to disappear caregivers, you then have to open up the breadth of literature that tells us that kids who are raised without that caregiver in their lives have enormous health deficits. So,
Mhm.
what are some of those? These are the adverse childhood experiences. If you don't have that primary caregiver in your life, particularly during the ages of 0 to 5, there's data to show that your brain develops differently. The size of your brain is different. The size of different portions of your brain is different. Your organs develop differently. Your coping mechanisms that help your body respond to stress are dysregulated. And so many of your organ systems are then bathed in chronic cortisol, which shapes your long-term risk as an adult of heart disease, COPD or lung disease, asthma, and other mental health disorders like PTSD and depression. Like separating kids from caregivers is a major cause of health inequities. And some argue, the folks who are really interested in toxic stress argue that this is the major cause of health inequities across society, across racial groups, across class. But we specifically around my work and thinking about how racism affects populations, think about the disproportionality that happens in communities of color and families of color, such that children are more likely to be separated from their caregivers at earlier ages. So the last thing I'll say is there's some bereavement research that I find really troubling that says that Black children, as compared to white children, are more than 3 times as likely to lose their mother by age 10.
Wow.
When you see that research, you have to start asking questions when you're thinking about the impact of racism. Like, what took that mother out of that child's life?
Mhm.
Was it the maternal mortality rate? Did they live in an area where the rate was 2 to 4 times, or in a place like New York where it's 10 to 20 times, depending on the hospital, for your mom to die a year after she's birthed you? Is it police violence? Because although our current focus right now is on how police violence ensnares the lives of Black men, it absolutely affects Black women, both as direct victims of police violence, as witnesses of police violence, and as family members who lose their family members and spouses as a result of police violence. Is that the reason that, Black kids are more likely to lose their mother at such young, critical ages? Is it arrest? We know Black mothers are also, and Black women in general, have higher arrest rates over their lifetime. They have higher arrest rates than white women and Latinx women. They have the highest arrest rates. Like, what are those forces, and how can we get at those forces to ensure that children have the social and emotional environment they need to grow and thrive?
Hmm. Dr. Boyd, I want to go back to something that you were saying, I think connects in terms of how we tend to think about police brutality in terms of like this one terrible thing that we've witnessed in front of us. And I think along similar lines, there's a tendency by white people in particular to say, oh, it's just like this one racist police officer. And of course, on multiple other ways we see where it's just like, oh, it must just be, this one racist person or this racist thing, putting it in a very like individual way. But I think it'd be helpful to talk about, and perhaps if you're willing to explain for us how police brutality or in these exposures to adverse policing in this way, or adverse police exposures, are actually a critical component of structural racism in the US, like how this ties into this much bigger idea of structural racism, and that it's not, just a few kind of, bad apples, as people like to think about it sometimes, in a police force, for example.
This is a great question that I get a lot, even from some of my pediatric colleagues. So just to say really clearly, the problem is not bad apples. The problem is the trees that we're planting, right? It's a systemic problem, not a problem of individuals when we're talking about how police harm communities and particularly communities of color. So when you talk about the trees that we're planting, the roots of that tree, the roots of the trees of policing start in slavery, right? The history of policing is that it began, particularly in the southern United States, as slave patrols. So although we think of police now as like organized police departments who are naturalized as part of our government, they were certainly not always that way. Police were often, in the North, the first police were volunteers called the Watch, who usually were convicted of a crime and had to watch as a punishment for other people convicted of crime. And in the Southern United States were slave patrols who were in charge of basically terrorizing enslaved folks who were seeking to escape and bringing them back into enslavement. It is part of why, and this is a small aside, it's part of why people would carry their freedom papers with them. So even if you were free, you were constantly carrying kind of proof publicly that you were allowed to walk in public space, right? If you just transport that model onto how people interact with police today, right? There are ways in which Black folks are still being asked to carry our freedom papers, right? When we watch what Amy Cooper did to Christian Cooper in New York City, right? Pretending that he was a threat to her and essentially saying that she had a right to be there in a way that he did not. She's trying to do the same thing. Now, Christian Cooper, right, went to Harvard. He's well educated. He's otherwise this beloved figure where he can pull out a paper and say, look at my credentials. Don't treat me like this, right? How do we as physicians sometimes do that in our own hospital settings? Do we wear a white coat when we walk in there so that the police don't treat us differently? So security doesn't treat us differently? So patients see us differently? Do people call you by your first name or do they call you doctor? Like there are all these ways that Black folks are still trying to escape this level of policing that says we are disallowed from existing in public spaces at the same way. And that starts with the root of policing and slavery. And it extends from there, that as we then institutionalized this fundamentally racist way of controlling people, as we institutionalized that in local governments, we allowed police more and more and more power and more and more and more money. For most cities, police are the largest single budget item on your local municipal budget. Like they usually get more than your public health department. They get more than education. They get more than transportation. They get more, right, than all of the public utilities. Police cost us an enormous amount. And it is partly because we have carried this narrative that to be tough on crime means that we need more police. Without asking the question, does crime and policing go together? Which the answer to that, and we could explore it more, is no, right? No, they don't go together. And does increasing police actually decrease crime? The answer to that is also no, right? It's why many people are now calling to defund the police and to fund services that could actually decrease crime, which is growing inequality in society.
Absolutely. Thank you. That's all really, really helpful to consider in this, I think. When, I guess as another kind of broad strokes question as we sort of frame, and then we can dig in a little bit more. I would like to talk about COVID-19 a little bit at this, particular time as well as we see, this particular pandemic illuminating some of these issues that have been present for so long. In a slightly different way, at least for some, though perhaps I would, we might say a predictable way, but illuminating it in a different way as well. Could you talk a bit about how, you started to explain, I think it was really helpful, how adverse childhood events and these both chronically stressful and acutely challenging crises can have impacts on a person's long-term health and as they go from children into adulthood, and how that creates susceptibilities. Perhaps could you maybe expand on that, and also other ways in which structural racism really leads to this incredible, the incredibly terrible mortality numbers that we started off with, for how Black Americans do have such high mortality rates from COVID-19 right now. And, perhaps with the idea of how might we combat this or address this in some ways. But I think understanding how it might have an impact would be really helpful for the audience.
Absolutely. So at this moment, when we're all having a national reckoning around police violence, while we're all in the midst of a pandemic, some people have called that like parallel epidemics in the United States, like two epidemics that are running alongside each other. But the truth is, they're intersecting epidemics. They're epidemics that contribute to each other.
Mm-hmm.
For example, when COVID-19 was beginning, many people described the risk factors for having complications or early death from COVID-19 being things like chronic underlying illness, particularly untreated illness, and advanced age.
Mm-hmm.
But then we have to ask questions about how police violence impacts populations' risk for chronic underlying illness, right? Like we know that having, and this is data actually that just, I don't even think it's published yet, that Professor Ali Sewell released on her website. She is one of the most preeminent researchers in our nation on the connections between police violence and health. And her most recent report comes out and tells us that if you are a Black American who lives in a neighborhood where police kill one other Black American, the population who lives in that same neighborhood, particularly the women who live in that neighborhood, have higher risk of hypertension and obesity, right? These are two disorders that have been circulated as potentially increasing your risk for COVID-19 mortality as well, right? We also know that people who are chronically exposed to discrimination have a cellular age that's in advance of their chronologic age, right? So you may be younger, but you actually may be cellularly older because of how, and this is work from Dr. I'm gonna mess up how you say her name, but Arlene Geronalis, who told us, right, about weathering, that chronic exposures to discrimination weathers cells. It wears them out. It shortens their lifespan. If you have cellular weathering, you also have increased rates of chronic illness. It's part of the mechanism why we think mortality rates, and particularly the racial mortality gap between Black Americans and white Americans in younger age groups, starting at age 25 to 54, are the highest, right? It's not just the elderly who have the highest mortality rate. When you compare by race, and you cited that statistic, it's Black Americans and white Americans age 34 to 45 who have that 9 times rate. But even if you go 10 years before and you go to Black Americans and white Americans age 25 to 33, they have a 7.3 higher risk, Black Americans do, of COVID-19 death than do white Americans. These are young people. And so we have to say, what is changing what possibly could be driving that mortality at such a young age? And when we know that police violence disproportionately impacts these communities and is a source of discrimination and violence in their lives, we absolutely have to place it as one of the risk factors for COVID mortality. We have to similarly think about that for kids. So for kids, we often think about not just experienced police violence, although kids absolutely are victims of use of force and violence by police, sometimes in their schools. We also have to think about what happens when kids witness police violence, which has also been well studied. And kids who witness police violence have been shown to have increased rates of other chronic illnesses like asthma, which is the second most common chronic illness in kids, which also increases your COVID-19 mortality, and chronic headaches. They have trouble sleeping at night. Their school performance is affected. They're more likely to have depression and PTSD. PTSD is one of those mental health disorders where you have hypervigilance, where you're always checking over your shoulder, where you're trying to adjust how you show up in society, even in moments of relative safety, because you perceive relative dangers, right? This is, again, even our children trying to get out their freedom papers all the time so that they're safe in society, knowing that they still may not be. These are the ways that we should think about kind of the intersections between what we're seeing with COVID-19 mortality devastating Black, Latinx, and Indigenous communities, and what we know about police violence devastating those exact same populations.
I think that's incredibly helpful and so illuminating. I think we tend on, um, we sometimes tend, certainly in academic medicine, to say, oh, yes, there are these disparities, and then that may go along with race, and then attributing certain parts of it to just, oh, it's where you live, or it's how much money you have, or maybe it's certain lifestyle choices or these things. But I think these much bigger issues where, not only do you think about that weathering of the cells in the sense, but these questions of how essentially how the genes of a population are impacted by critical events such as police violence happening in their specific community, and that there would be in that community these kinds of health impacts in terms of hypertension and asthma, for example, that we worry about with kids all the time, and those issues. I'm also really struck, I keep thinking about it in your reference to the idea of, having to keep showing one's freedom papers, of, the multiple examples there have been where people have literally been killed by police essentially trying to get their papers out, like, reaching for a wallet or, an identification, and the process of having to, ask for permission to do that, and the vigilance around, where your hands are and how you're interacting with police in those encounters, which hopefully increasingly people are aware of what, that how that impacts, encounters very differently for Black people with the police than what most white people are ever thinking of in those encounters. And sort of on this broader level of what that vigilance, just as you said, that constant attention to, even the tiny little things of, like, where do I put my hands? How do I stand? How do I look or not look at someone? How do I, be careful not to draw attention to myself, perhaps, or in certain ways that you are supposed to draw attention, just that chronic vigilance and the stress that would come of that. And not only the impact that might have on your mental health, but also, on the health of your cells and your broader chronic health as well. So it really, I think bringing that into the discussion about COVID risk is a really helpful one that way. So thank you for explaining that much more.
Yeah, actually, if I can say one more thing on
Yeah,
that
go
point.
ahead. And of course, yeah, please keep.
Because y'all know I got a lot to say about this. I was recently on another webinar at Harvard's Kennedy School with one of their professors, Leah Wright Rigueur, who is incredible.
Mm-hmm.
And she made a point that I also want to share that I think is really critical, which is that Black people live in this country without sanctuary, right? There is no sanctuary from these intersecting forms of violence that are threatening our lives. There's no sanctuary in our schools. Kids have to face police when they go to school, right? There's no sanctuary in public spaces. We've seen with the Amy Coopers of the world, the barbecue Beckys, the ways that white folks also deputize themselves to police public spaces. And we see the mortal risk of that with our young people like Trayvon Martin, right? You can't walk down your own sidewalk with Skittles. You can't wear a hoodie. You can't have a toy gun in a park, Tamir Rice. Right? Black people are absolutely without sanctuary. Even in our own workplaces, you are constantly contouring yourself to try to keep yourself safe. And then when you actually have that encounter with a police officer, and I think it's the tape of Eric Garner that's the most devastating. If you listen to that transcript, and only those who are honestly able to listen because it's incredibly traumatic to hear. But if you even just read through what he said to the police as soon as they come up to him, he says, I know what you want to do. And you can't do this again. Like, he refers to the fact that this has happened to him before and that he is completely aware of what might happen right now. He puts his hands up nearly immediately. Right? We have to think about what that does inside somebody's body. Because in a moment where you know that you are at mortal risk, every human being and a number of other species, right? This is not just humans, have a flight or flight response, which means in that moment, your body shifts all of its resources. It shifts where it sends blood flow, it ups your adrenaline, it ups your cortisol, it sharpens your vision, it puffs up your muscles, it sends blood away from organs that digest and rest to the organs that are ready for you to run a mile and lift a car, right? In that moment, your body is preparing you to survive. And what we're asking Black people to do, essentially what police are asking Black people to do, is to learn maneuvers to turn off that physiologic response, right? To raise your hands and pacify yourself, to not run, right? Fight or flight. Flight. When people run from police, this is a physiologic response, and turning it off is nearly impossible. And when you do turn it off, especially if you chronically are forced to turn it off, that has a long-term toll on your physical health and well-being, not to mention your mental health, because you will continue to switch into that mode even during times of relative safety. Like, that is how severe and damaging these reactions are, and that these interactions are, and why I also am not an advocate for community policing, because every time police want to try to have these innocuous interactions with folks, it is triggering the same physiologic responses in people, because everyone knows those innocuous interactions can turn on a dime, and that you have very little control over them. So we have to be really mindful of the reforms that we're talking about when we're discussing what progress would look like.
Sure. Yeah, that makes a lot of sense. How so as a pediatrician and someone that advocates for kids, at a lot of different levels as well, but really thinking about I'm especially thinking about when you're talking with families, how do you talk to parents about how to talk about these things with their kids, particularly for Black kids who, as you use this incredibly compelling reference, that are essentially growing up with no sanctuary, even in their homes, in their beds, as we've seen, playing with toys. How do you how might parents talk about that? And also, like, are there strategies we can recommend for better protecting and supporting children and adolescents right now in the midst of these pandemics as well?
I'm going to start with white parents. White parents have got to talk to their kids about racism and police violence, period. And they need to start really young, because kids understand their own racial grouping and how it is perceived in society as young as preschool age. And we've known that since the 20s, since the 1920s, right? When, I'm blanking on their name, but that husband and wife duo, I'll look up their name in a second when you ask the next question, showed us the doll studies, right? Yeah. When kids as young as 3 to 5 were able to identify, even when they were that racial group, that the white doll was preferred, the white doll was smarter, the white doll was safer than the Black doll in every way, right? They weren't choosing dolls in the middle. They were always going to the furthest extremes, and then naming themselves. I mean, what was most devastating about it was then the Black children even named themselves as the Black doll, even as they said all of those negative things about that doll before. So kids know really young. Black kids know, white kids know. And so when parents try to shield, particularly white parents try to shield their kids from having more informed conversations about that racial identity and that racial socialization, that then translates to how kids go to school, because they know that they are the preferred racial group, but they don't have a context for what it means to model active bystanding, right? Upstanding for the people that they see experiencing events of whatever kind of harm, even just bullying on the playground, right? Like, we need to model and prepare our kids to take with them an understanding of how that racial grouping and how that privilege and preference that is given to white children over Black children at a very young age and throughout our lives affects them everywhere else they move in the world. So first, white parents have got to start talking about it. And there are helpful, people can just Google, how should we talk to our kids about it? There was a really helpful CNN special with Sesame Street that actually had Elmo, I loved it, talking to his dad about racism. And basically, his dad said, not all streets are like Sesame Street. And that's a great way to start, right? Not all kids are treated like you are, is what parents can say to their white children. And then explain to them the differences, and then explain to them concrete ways that they can make a difference in the world, that they can change things. For Black parents, these have been, I won't even deign to pretend that I know that I'm going to educate Black parents on how to do this. Like, Black parents have been doing this. My parents did it for me. Like, it is a conversation that has been happening in our communities.
Sure.
And it's also a devastating conversation to have, right? Because it's fundamentally different than what white parents are going to tell their kids, which is like, try not to participate in these systems that harm people and stand up for people when you see them being hurt.
Right.
But for Black kids, you're trying to actually keep them safe, knowing that the advice you're giving them may not keep them safe.
Yeah.
Right? You're trying to tell them that even though you're still just a child, to other people, because of your growth spurt, they may perceive you as an adult and treat you in ways that are completely foreign to you. They may criminalize you in ways that hurt your feelings. They may criminalize your peers in ways that are unrecognizable to you. And that internalization of how the world perceives your racial group is deeply hurtful. And to have your parents have to be the ones to break it to you before the world breaks it to you is, right, profoundly harmful. Like, it hurts to have those conversations, but they're had because of concerns about safety. And so they're still important. But the only thing I ever say to parents is not how they have the conversation, because they know how to have it. It's just to remind kids that it's unfair and unjust that they have to do it, that it's not right, that it shouldn't be like this, that they're not really like that. That's just how other people see them or may see them. And that helps, I think, in a way, buffer how hard it is to hear those things and how devastating it can be to young kids who are just coming of age, coming into their own.
Yeah. One of the things I wanted to ask you about, and this reminds me, or kind of leads to a little bit in terms of thinking about, like, in the midst of having those devastating and unfair conversations, what families might point to is thinking about the protests happening right now. And I guess along those, I mean, not that by any means that's an antidote to that, but thinking about how protesting is and has been an intervention for public health and what that looks like right now. And I wondered if maybe you might expand on your thinking about that as well. How protest might be part of this. Well, as a note, people are helping us out in our remembering of who did those experiments related to preschoolers and dolls and so on, which was Kenneth and Mamie Clark, it looks like. So. Yeah, so good job, audience. Thank you. We're like, and actually we'll turn maybe, I think we'll turn over to the questions in just a minute soon, but I wondered if we could maybe touch on the idea of protest and in the midst of this, especially because it is an area where right now, we hear people asking questions that are specifically related to, thinking about the police brutality and why there are protests happening and how important it is to keep having public momentum and protest related to police killings and violence and this particular part of the unjust racist system. And also at the same time worrying about this infectious pandemic that we're in the middle of and how to weigh those things, which, I think you can talk about kind of where you come out on that as well, which again, I'm happy to talk about too, but I'd love to think about that a little bit with you.
Yeah, hands down, protest saves lives, period. Like in the beginning of these protests, after that brutal murder of George Floyd, some public health experts came out and said, what about risk for COVID? And immediately I went on my Twitter and I just said, protest saves lives. Please ask me to write about this. Please quote me as a doctor saying this. It is critical we understand it and that we support these protesters and make it a safe and healthy environment for them to be in. Why did I do that? I did that, number one, because I think it was disingenuous. I think people were just trying initially to discredit what these protesters were doing, because those same folks were mighty quiet when white folks were marching up to state houses across the country, unmasked, shouting in police faces, talking about reopen the economy.
Yeah.
So don't come for these protesters if you didn't come for those ones, right?
Yep.
Second, if we understand the history of Black protest in particular in this country, which has been really the root of a number of liberation movements in this country, like the movement for women's liberation, Black queer women, the movement for queer liberation, right? Black queer folks. Obviously, Black liberation, some of the protections we all have in our workforces and our workplaces, protections that we have when we go into public spaces, when you try to seek a service, all of those protections from discrimination came at the struggle of Black people who are protesting in the streets. Now, it need not be that way, right? We as a country have kind of fetishized and required that Black people physically bear their pain for us, right? This is the visibility of the civil rights movement. Go into the streets, be pounded by water hoses, be bitten and chased after by vicious dogs, be brutalized by the police, be maimed by vigilantes and white mobs before the country says, you know, maybe what's happening in the South is completely out of control and we have to change the law so it doesn't happen anywhere. Yeah. Like that visibility is what has brought many of the protections we have in this country, despite your racial or ethnic group. It's the root of our equality in this country. And once you understand that equality and equal access to rights and resources saves lives, then you understand that our process to get there, protest, is the number one way that does it. It's the most effective means. If it weren't for the George Floyd protests, we probably wouldn't even be having this talk right now. Most medical schools wouldn't be talking about their curriculum around racism. Colleges wouldn't be saying we're starting new centers on race and equality. You know, the NFL would have never apologized to Cap. Like, these protests changed everything.
Yeah.
You know, tons of commercials, public, all these organizations are trying to now respond to how they've addressed racism. Amy Cooper 100% would have been fired for what she did. A lot of people did that before and totally got off for it, right? The woman who lied and said Emmett Till whistled at her is still, she lived her whole life free before she died, right? This has never been penalized. And now folks are starting to be penalized. Now we're finally calling for defunding the police. We should absolutely thank protesters for all of that. And we as healthcare professionals should keep it safe, right? We should open free testing sites at protests. We should offer free masks for protesters. We should ensure that everyone has hand sanitizer. Why not screen for other chronic illnesses right at protests? Like, there are things that we could be doing to support these protests because they're absolutely critical. And I will never come out and say one bad thing about them, because I am deeply, deeply grateful to protesters for the protections and safeties that I have in my own life as a Black woman when I leave my place, when I leave my job, when people don't know that I'm a doctor. Like, I'm safe in this world because of what protesters and generations of Black resistance and struggle has done to make me safe in this world.
No. Thank you. Yeah, that's great. All right, we'll leave it with that one. I think let's turn to some of the questions that are in the question and answer box, and certainly feel free to add questions now if people have them. We'll take a few of these, then maybe come back to you, Dr. Boyd. There's one, so starting off saying, Bill and Melinda Gates stated in the media that when a vaccine becomes available, recipients of the vaccine should be prioritized with Black people at the top of the list. But also within the Black community, there's always been a distrust of North American structures of power and control, even when those who represent those structures position themselves as wanting to help the Black community. How might you respond to the suggestion from the Gates and the cultural distrust of the Black community as a response to this suggestion?
So colleagues and I just published a piece in Health Affairs called On Race something. I don't know, type my name and then On Race. And it's about some of the publishing standards around racial health inequities. And we particularly take on this idea of distrust, right? Distrust has often been offered as a way to explain why racial health inequities persist. Like, if only Black patients trusting more. They would utilize healthcare in a way that keeps them healthy. The similar arguments are coming up around the vaccine. If only Black folks trusted more, and I'm not saying this person is suggesting that, but I think this is really important to investigate. Like this idea that trust is really the barrier to Black folks from equitable care and positive health outcomes. And I just want to frankly say that's completely untrue, right? What is the barrier is racism. What is the barrier is that Black people have inequitable access to every healthcare service in this country except amputation, right? That's the result of unequal treatment, the IOM report on health inequities. Like, we know that we don't treat Black people the same as we treat other groups systematically, not because of an individual implicit bias, like across the board, Black people don't get what they need. And so to pretend that then that distrust that Black folks may harbor as a result of not getting what they need for centuries is the real barrier, skirts our own responsibility as a system to actually do something different. I think in the article we say it something like, which really the problem is not that Black people aren't feeling something. The problem is that our systems aren't doing something that they have needed to do for a long time. And so around this vaccine, systems are going to need to make major changes. We can't just roll out a vaccine and say, everyone needs to take it. Come on, Black folks, why aren't you taking it? We need to say, hey, we have not treated you equitably forever. We likely aren't going to equitably distribute this vaccine to you based on your insurance status, based on the type part of the country you live in, and what your overall access to healthcare is. Like, so we want to fix some of those things first. We know that you have other chronic illnesses we've completely left untreated and that we sometimes don't even cover. We want to cover that first. And then once we take care of your needs, then, right, we'll ask you to get this vaccine to help the rest of society reach herd immunity. But before then, I think it's disingenuous. And it, again, asks Black people to sacrifice for everybody else to have something that we may never fully benefit from. Sure. So we have to be careful with distrust. I said it better in that piece and I tried to summarize it right here. So maybe we just read that.
No, I think that's helpful. And actually it's interesting because the next question that I was looking at on this list says, no sanctuary is a tragic, real, and powerful. What are some of the ways that our own healthcare organizations might become sanctuaries? We're so far away from that in healthcare. How might that be possible in America? And I think that actually speaks to exactly what you were just saying in terms of the very real ways in which our healthcare organizations, as specific organizations, but also broadly across, our country, fall short and have not just fallen short, but have systematically embedded discrimination within them for years and years and years, that it's, that these are appropriate responses to organization in the sense of being concerned that it's an appropriate response to an organization that discriminates against you or doesn't offer what you need in that way. And I guess any other points you would want to make about ways that healthcare organizations might slowly, or it would be great if it could be fast, but I think like how we might draw ever closer to goals of throwing out these inequitable systems?
Absolutely. And I just want to thank that anonymous attendee for this question. Healthcare is not a sanctuary either, right? We are sometimes a source of violence, as you're alluding to, Dr. Freeman. Health is also like the source, the healthcare system and going to hospitals and clinics is sometimes a source of violence in people's lives that harms them. We know it's been a source of historical experimentation against Black folks that continues in some ways to this day. But specifically, it's not even a sanctuary from police violence. When people go into emergency rooms, usually the front door is manned by, if not an armed security guard, a local city police officer, right? If you have had other interactions with that agency, and there's data on this, actually, I should just cite Rachel Hardiman, an incredible researcher who we also co-published in the New England Journal recently on, what happened with George Floyd. Her data shows that police violence in a community actually decreases healthcare utilization for every racial group, not just Black folks, right? Like the fact that we refuse to provide sanctuary everywhere, including our hospitals, from police violence and from exposure to adverse policing exposures, like that then shapes how everyone uses healthcare. So what we need to do, and what I absolutely advocate for, is removing police from hospitals. The same way I'm like police-free schools, I am like police-free hospitals. People are at their most vulnerable when they come to the hospital. Physically, emotionally, it absolutely should not be a site where they are exposed to the violence and surveillance of local police. So we need police-free hospitals. and clinics and healthcare systems. And we also, and I saw there was another question about what about patients under correctional control? Because sometimes when people have to come to the hospital from a local jail, pregnant women who are jailed will have to deliver their baby in shackles.
Yes.
Juveniles who are jailed will have to come in, for whatever their chronic illness is, for surgery, and have their whole stay in shackles.
Yeah.
Like, that is horrific. It is absolutely a violation of our responsibility to do no harm. And we should consider it that way. And also treat patients who come to the system from the correctional system completely differently and with the same dignity of any other patient. And at the same time, the last thing I'll say is, as physicians and clinicians, we should also absolutely advocate for abolition. We should absolutely challenge whether any patient or community thrives when they are confined. We know during COVID, the 8 out of the 10 outbreaks in this country have been in correctional facilities. Like, we know those are high-risk sites for the transmission of infectious disease, especially during a pandemic. And many have called for decarceration under those terms. We also know that children who are detained at the border with their families have enormous health inequities as a result, and sometimes may never actually psychologically recover from being separated from their parents and families in that way. We have to call for the end of child detainment, period. Right? The end of family detainment, period. The end of the detainment of any immigrants or asylee seekers at our borders, period. And we have to call for the decarceration of populations everywhere. It's not just that nonviolent offenders have to be released. We have to find a way as a society to actually confront the harms people create without throwing people away like they're disposable, because that also is a source of our structural racism, because we disproportionately throw away Black and brown folks and their futures and their right, and that affects them intergenerationally. So we as hospitals should be sanctuaries. We as physicians have to advocate for abolition, and we have to think of that broadly in terms of how it affects us in the public, how it affects immigrant communities, and how it affects kids.
Absolutely. Can we vote for you for president? Like, would you like to run? I would be thrilled with that. But there's a question here about what police reforms you feel would be helpful, which I think, since we haven't given you necessarily, I think some of that starts to get into, changes more broadly and thinking, as physicians and health systems, what we might change. But I'd love to hear you talk a little bit more about what you think might be helpful in terms of police reforms in the face of all of the really terrible impacts that we've been discussing.
Abolition. So we can no longer pretend that just reforming a system that has continually, persistently harmed people is sufficient to prevent that future harm. Like, every past generation that has tried these reforms in the 80s, the 90s, right, in the Obama administration with the president's 21st Century Task Force that continue to articulate ways that community policing might work, we can no longer pretend those have been effective. They have not. We have got to move towards abolition, which entails a new form of community level supports, both for community crises and for the ongoing inequality that then becomes a source of quote unquote crime in people's lives. And I say quote unquote crime because what is labeled a crime changes all the time. It is not a static definition for certain behaviors. It is a way to control how populations move in the world by labeling behaviors that certain powerful groups find like threatening crime. So we have to have a way of moving towards the abolition of this practice, because at its root, it is structurally racist and has consistently been harmful. You begin that process, and if folks are interested in more information, because I am not the expert on this, right? Angela Davis is, Ruthie Gilmore is, I would refer to Critical Resistance. I tweeted out a couple of weeks ago, but you can also just go to Critical Resistance page. They have a list of reforms that move us towards abolition and changes that do not. Major ones that people have brought up that I think are important to focus on are police-free schools, police-free hospitals, right? Creating sanctuaries in spaces where children and the infirmed should not be exposed to the violence and surveillance of policing is critical, but also just defunding local police in general, shifting our public resources and investments to actually supportive programs instead of ones that continue to harm people. But I will refer to Critical Resistance because they have a beautiful list of reforms people can take.
Terrific. And I really appreciate how you've been giving us references and people to consider and work with that as well. I guess along those lines of thinking, I know we're kind of wrapping up our time, but thinking of active next steps, actions, and where people can, not only, I guess, both learn more and figure out how to act more broadly along these lines. Of course, as we've been saying, there's been much more acknowledgement recently of how there is institutionalized racism in our schools, in medicine, in academia. And along the lines of thinking of resources, we have a question about the book White Fragility and some others, and thinking about next steps. So I guess I would ask you as a broad question, I mean, you can answer it as specifically as you want, but framing it more broadly for institutions and also individuals who are really interested in creating either anti-racist departments or health systems, as well as their individual actions. Do you have some key steps that you're willing to recommend or share with people in that? And you could talk about it maybe both at a system level as we think about some things, but also at an individual level in terms of some additional resources or steps that you might push people towards.
Definitely. And I also want to hit on that gun violence question if we have time for it.
Oh,
So
yeah, sure. I know there are lots of great questions.
There's so many great questions in here. Thank
Totally.
y'all for these amazing questions.
Yep.
So one, for universities who are thinking about creating their own new departments about race, racism, anti-racism, first I would say, how are you supporting your existing departments that have long been doing this work? How are you supporting the faculty who created the evidence base that you're now using to say you need a new department? Many universities George Floyd were cutting under the economic constraints of COVID, were actually cutting their African and African American studies programs, their ethnic studies programs, their women's studies programs, right? Like the social sciences. The social sciences are the base that help us understand what anti-racism even looks like. So for a lot of folks, it's not that you need to start something new, it's that you need to invest in what's already existed on your campus and the faculty that have made that possible for students on your campus. Yeah. In terms of books to read, I did leave on Twitter, and this is a very popular tweet, I'm unsure why, like some references that people could consider. Things like Medical Apartheid, Killing the Black Body, Medical Apartheid by Harriet Washington, Killing the Black Body by Dorothy Roberts, that specifically is looking at our healthcare system and how racism has been embedded in our systems for centuries and what we need to be doing about it. Those are really powerful. Race After Technology by Ruha Benjamin, which specifically looks at the digital infrastructure that's emerging and big data and how that surveillance system is another form of policing we need to confront. At 2 p.m., I think she's on with Dorothy Roberts with Hayward Books. If people are able to jump on that lecture, I think that would be amazing. And Isabel Wilkerson's book. Why am I, hold on, let me look up this title because this book is amazing and I literally just had it on my table.
I think you also mentioned in that list, you want to talk about racism too? It's just like,
yeah. Thank you. The Warmth of Other Suns. God, The Warmth of Other Suns is one of the best books I've ever written, right? This is a book about the great migration of Black folks, the largest migration of any population in our country's history as Black folks exiting the South post and during Jim Crow. So this is an enormously important book. It is about our history. It outlines and tells the stories of folks so that you can understand more of what's behind the numbers and more of what's behind where people live, what forces have shaped how they live and their health prospects over time. That book won a Pulitzer. Like, it's not even just like, oh, is it good? Like, that book is excellent. Read it. Don't read White Fragility. Boom. Do not read that book. Why? Because White Fragility, frankly, is not, the other books that I'm recommending are actually have a true analysis. Like, it's going to give you an example of terms and definitions of those terms and place those terms within a historical context that the books name. There are a lot of popular books written about racism that don't force people to actually learn anything about it other than self-reflection. Self-reflection is insufficient to actually prepare you to confront these systems as they manifest in your own life. You can reflect a lot about what it felt like when somebody asked you about racism and still not know anything about the broader sources of racism you also participate in society and benefit from. That is why I say in some sense, don't read White Fragility, because I don't think with everyone's limited time that it actually moves the needle. But if folks want to talk to me more about that, I could talk about it more online, but there's so many better books. Just read the better books. And then I do want to say a quick thing about the uptick in gun violence.
I was going to agree. We should definitely go to that.
This comes up all the time, right? Which is like, but what about either Black on Black crime, or what about crime rates, and is that increasing with the police? And I just want to underscore the fact that it does not follow. So first, every racial group is more likely to have intra-racial violence, right? Black on Black crime is at the same rates as white on white crime, as Latinx on Latinx crime. Every group, most crime is between intimate partners, between people who actually know each other, is where violent crime happens. So it tends to be, because our society is so segregated, between your own racial group. As we see an uptick in gun violence, we absolutely have to ask about the growing inequality in this country. More than half of Black folks have lost their jobs since COVID-19 started. And we have the highest unemployment rate of any group in the country, 16.8% in June. Like, it is enormously high. Black people are struggling. It is not just that there's violence that's threatening our lives, but we're otherwise making it. Black people have been disafforded and divested in the resources they need to survive. And that is only getting worse right now. So if you're asking about what's happening with crime, we have got to make people's lives more livable. People need more resources. And when I presented to Congress, I said, we need sustained relief for people that essentially is indefinite. A one-time $1,200 check that went to some families was nowhere near enough. Everybody, every single person, universal basic income, needs a check every month to at least cover their rent so that folks aren't struggling. And I think that's why we're seeing an uptick in violence in communities.
Thank you. No, that's terrific. I'm so glad that we went to that one. Let me, as we close out, I'd love to give you, a moment for any last words that you would like to share. This has, of course, been a lot of really heavy and difficult things to go through in this way. And I would particularly wonder if there's anything in this that gives you hope that you want to talk about, or where you find hope for the future as you dig in with this difficult discourse around this.
You know, I take hope in protesters. I take hope in people who are literally putting their lives and their livelihoods on the line to keep people that they've never seen and never spoken to safe. Like, that's what it takes in a pandemic to keep people safe. It's what herd immunity is based on. Every public good that we need is based on doing something for other people who you may not relate to and may not directly know. And I'm super grateful to protesters. I'm super grateful for the abolitionists, right? Like, imagine what it must feel like to be Angela Davis, who was talking about abolition and like laughed out of rooms decades ago, who was told that she was illegitimate for bringing forth a platform that is now we are thirsting for. Like, we were starving without that. And now we finally have a direction forward. I'm so grateful that she could world build and have the imagination to create something that made no sense to people in her time, but makes complete sense to us now. And in that same regard, I'm incredibly grateful to my own ancestors and to the ancestors of Black folks and laborers and workers across this country who have essentially continued to resist systems trying to harm us in every way. I think that is the blueprint for all of us, like, to just try to stay brave and try to stay resistant and not let these systems eat us up. Because if we all kind of align ourselves, they can't. And I think these protests are showing that. Everything will change if we all just get aligned. And the last thing I'll say is, it's also not just Black protests. These protests are multiracial. And that's what I mean by we all get aligned. Everybody has to get out there and say the inequality is hurting all of us. And we all have to do something about it.
Thank you so much. I really appreciate your time today and your sharing with us. We will be posting a recording of this webinar online. It's usually up within a day. Thank you to everybody who took the time to join in this conversation with us. Thank you, Dr. Boyd, for all that you've shared and the resources and steps forward. And we really hope people will continue to join us for these webinar series as we go on as well. But thank you, and very best to you. Thank you.
Thanks. Thanks, everyone.